There you go. This is Joy 99.7 FM. Good evening and welcome to the fourth edition of our health and wellness series here on your superstation. The mission is to stay alive, just like Bee Gees are singing, staying alive. We want you to stay alive and live a healthy, quality life, actually. And that's why we bring you all these series every quarter here on Joy 99.7 FM. It's another quarter, and we bring you a very important aspect of our lives that probably, I would say, is often overlooked, but very, very essential. My name is Lexis Bale. It's going to be a couple of hours of very educative talk. So please make sure you're here for the full length of the show. You can share with your family and friends as well. I'm sure probably you're driving home now, you're stuck in traffic somewhere. Leave the dial up here. If you get home, don't worry about losing the radio feed. You can go onto our Facebook page, because this conversation is live on Facebook. You can check out the video. So wherever you are, you can listen to us. You can share the link as well with your family and friends, because this is a conversation that everybody needs. Yeah. Now, this edition looks at a focus on building healthy relationships, with a focus on men and women's reproductive health, because we know it's quite essential. And so we decided to table this particular topic for conversation. And we're looking at from fertility to sexual health. I mean, these topics affect individuals, families, communities in profound ways. Tonight, we're shining a spotlight on both men and women. We're breaking down the myths, we're addressing the concerns, and providing expert guidance to help you make informed decisions. And we're honored to actually have two very distinguished professionals joining us to speak to these topics. And for starters, Dr. Prof. Sefogah. He's a consultant obstetrician and gynecologist and fertility specialist at the SHIP Healthcare Specialist Medical Center, and he's also a senior lecturer at the University of Ghana Medical School. Our second speaker is also a senior lecturer and consultant urologist. Is Professor Matthew Yamoah Kyei. Now, together they'll take us through the essentials of reproductive health, tackling issues that affect men and women alike. And of course, we want to hear from you as well. Our phone lines will be activated a bit later in the conversation. Our WhatsApp platform is active from this minute, so you can actually send in your questions ahead of time. Anything you need clarity on, you can send us a message on 055 997. A bit later, then we'll activate the phone line so you can call in. We're streaming live on Joy FM, Joy News, Joy Prime, on our YouTube platforms, on Facebook Live, like I mentioned earlier, and as well on myjoyonline.com. So wherever you are, you can actually stay tuned in to this particular very important dialogue. So let me get to welcome my guests and see how they are feeling today. I know they have very, very busy schedules, so I'm really happy that they're here. Dr. Sefogah, how are you doing?
Yes, sir.
So good to have you here again.
Thank you. It's a
And of
pleasure.
course, Professor Kyei is also here with us. Prof, how are you?
I do very great.
Good?
Glad to be here.
Nice. What kind of day have you had today?
They just have busy times, interruptions here and there.
Yeah.
It's for the good.
A lot of your patients are listening.
Yeah, they are.
Those who are waiting for you to.
I'm sure of that.
Anyway, so let me start off with you. Why do you think this conversation is really essential, Dr. Sefogah?
Yeah, I mean, thank you, Lexis. It's important because, you see, we are increasingly realizing that there are lots of issues that people are either sweeping under the carpet
Okay.
and not really dealing with them. And especially when it comes to sexual dysfunction, fertility-related issues, and mental health, which affect infertility, childbirth, preconception, and we hardly shine enough spotlight on
quite emotionally involved. Also, we realized that for us, in addition to all the emotional issues and happiness, sometimes also portends your life really what's happening to you. Sometimes a mark of actually a bad disease. Some people come with irritable problems, and you find out that you've got diabetes, your sugars up the roof. So not only do we look at you, making you happy and a partner happy, but also asking, hey, has it got anything to do if you are threatening your life?
Yeah.
And we look at it. So for us, we take it very seriously, and when we think that all the chips are falling to good places, then we can laugh with you.
Yeah.
But beginning, we are quite serious.
I can imagine how difficult it is for you as well. And I'm saying that from the perspective of trying to figure out diagnosis, because these issues around especially men's sexual health are things that they hardly talk about.
That's right.
That sometimes they try to cover up, they try to be a little modest about it, but I don't know how you're able to do it. You're a professional, so you probably are able to fish out these things, but you experience the should I say the lacks with men trying to give off information about the problems that they're going through.
Yeah, I think it's quite a difficulty for men to do that. I mean, generally men don't want to appear in the hospital. Remember, one man appeared the clinic, irritable issues, and the first thing he said was, "Can you speak to Madam on the phone?" and I was wondering. I mean, we have not even exchanged pleasantries and who you are, just to confirm that he had come. So Madam, husband is here. That was enough. And so we tend to, brave it and not show up. But it eats us very well. So it's difficult. So that to unveil, to undress can be challenging.
Is it the same with women? I have a feeling that women are quite maybe more expressive about their concerns. Would you say so?
No, I mean, that is really true. Women are a lot more help-seeking.
Okay.
And the men typically, they are braving the thing. Meanwhile, there are issues. And they wouldn't even come forward with their partners.
Yeah.
So the women are coming to consult sometimes me on behalf of their partners.
Oh my goodness.
But the point is, men, let's step out.
Yeah.
Let's step out. But there's a saying that if you sell your sickness, then you can get the cure for it. Exactly.
Can you cheat? Anyway, no, I mean, if there's any takeout for this from this conversation this evening for me, I'm hoping the takeout will be that men will be bold enough to seek help when they need it. And probably even earlier before, because a lot of the times they wait and think there will be a bem and then before you realize it's actually out of proportion. So if there's any takeoff, if you're listening now and you really need help, our professionals are there. There's so many avenues you can reach out to them to seek the help so that you can save yourself the trouble of probably something exaggerated over time. So let's set the ball rolling now. I'm going to start off with you, Professor Matthew Yamoah.
That's right.
Professor Kyei is a senior lecturer. He's a consultant urologist, one of the best in the country, and I'm sure a lot of his patients are tuned in. So you probably have encountered him before. Now he's going to give us a 20-minute presentation, circa 20 minutes, about men's reproductive health and the issues that it comes with. Prof, over to you.
Thank you very much. So reproductive health among men, I mean, we say it's a medical specialty. I mean, researched, studied, practiced over years and to the highest of level. So whatever the issues are related to a man's reproductive health, I mean, there are experts available to help deal with it and research to its fullest. When we talk about men's reproductive health, probably the commonest areas you may want to look at is erectile function, issues with fertility, what we call male factor, infertility issues. Sometimes we come in for infections, sexual transmitted infections that men do, experience. And then, of course, people come and there are various shapes and sizes and deformities to the penis and the organs which we have to deal with and things that threatens them. And well down the ages, the prostate issue also do come in. But for our purposes, probably we may look at the erectile issues of function, we may look at the male fertility issues, and probably talk a bit about the deformities that people encounter. And if there's time, we may stray into the prostate that is all over the airwaves. One important thing that men should know is that when you talk about erectile function, every aspect of the man is important. In fact, I normally tell students that a man is an erection and an erection is a man. From your heart, from your lungs, your liver, your intestines, all of them contribute the brain to a very good erectile function. So what it means that erectile function can be an indicator of something wrong in any part of your body. But of course, the one who bears the brunt and able to tell what is happening will be your erection. So generally, we say that if you have got an erectile problem, it's an antenna of something not going right. If there's something not going right, it can be social. You don't have cash in the bank, it will show in your erections. You are disappointed, you have failed an exam, it will show in your erections.
Really?
So psychologically, anything that goes on, erections will the first to tell you that where you are sitting is not a very comfortable place. You have something to do to get a place better. Then the organs as well, generally, will come to the penis itself. But before the penis responds, you can't see well, your heart is not beating very well, your liver is bad. A friend was telling me a particular incident start by somebody in the flight across to Takoradi, and saw the man's spectacles very, very dirty and blind. He couldn't eventually see. And she, being somebody in the ophthalmology or eye area, picked a slip and said, "Look, can I clean your glasses for you?" So he did clean this man's glasses, and after he was done, the man said, "I didn't know you were so pretty." First, could even say thank you for what you have done. So even the eyesight being dim, had effect on how he responded, reproductively. So all part of the body is responsible, and of course, the genitals must also be good for it to happen. The penis, the testes, and of course, the scrotum. So when we say that there's a problem with the erections, we say that the person has difficulty to achieve an erection or maintain it as long as he wants. We will say satisfactory. And we always say that this problem may have been going on for at least 3 months. Okay, good. When we say achieve an erection, it means it must be strong enough. And studies have realized that across all ages, about 15 to as much as 25% of men have difficulty achieving an erection or maintaining it, erectile dysfunction, from below 40s, 20s, up to the 60s. Of course, because some of the challenges that compound these erectile issues happen throughout ages, like your diabetes, like your hypertension, the incidence gets higher and higher, as much as sometimes 50% among people who are around 40 and 50 years old. So it can be very, very high. In fact, some studies in other countries may come back as much as 6 out of 10 men have issues with erection at a point in time, in their lifetime. So that's how common it can be. Now, why is it that someone is having difficulty to achieve an erection? Generally, achieving an erection depends on what we call the psychological issues that happen, which is in the part of the brain we call the limbic system on the brain. So, what you see, and we always say when the women say they are dressing to kill, they know exactly what they are going to do, because what you see can stimulate you and make you achieve an erection. What you hear, "Oh, darling, I miss you, sweetheart," is enough to get an erection. But if you enter the house and the first thing is that the light has gone off, no matter what you brought from home, it will just drop it, because you have to solve the problem because there's no electricity, the water is running dry. So generally, to achieve an erection, the psychology must be good. The associations, a nice program you want, a nice dress, all these things can make the erections good. So to achieve an erection, you need these psychological things. And what you know is that for a man, our male hormones or testosterone is what keeps the psychological in its peak. So when your testosterone is very high, when your androgens are very high, it takes very little to stimulate you and to get you going. And what you realize that the highest level of testosterone is in your 20s, 20, 24, 25, that's what you call the highest level. But even as you get older and the testosterone levels tend to go down, when you exercise, it makes it very sharp. So an elderly person may have a low testosterone, but if exercise, that testosterone is sharp and active like any young man. So one of the things that we talk about in reproductive health is that, you have got a lot to do with your exercise life, with your activity. A good exercise, a good activity, erection will always continue to be at its peak. So that is achieving. To maintain it requires that the nerves and the vessels are working very well. You call it reflexogenic, the touches and things like that. So anything that dampens your nerve, especially the nerve that supply the pelvic area, will make it difficult to maintain an erection. And so the things that dampen the nerves, are diabetes, which in the long run can affect the nerves. back pain, spinal injury, you have lifted something and you've got a, something in a click in the spine, can be an issue where the nerves are not functioning they want to have. If the vessels are becoming clogged up because your fats are very high, because diabetes is uncontrolled, because the hypertension is all over the place and the vessels are clogging up, then you realize that you are not able to maintain those erections. So the psychology will rise it up, but within 30 seconds to a minute, it's all gone, and you need these systems to keep it going. So you must achieve and you must maintain it. Anything that affects the vessels and the nerves will make sure that the erections are not as effective as you want it to. And of course, you say satisfactory means that it depends on the partner as well. So as you said, you must discuss your partner. What are expectations? Did I do good? Did I do bad? And get the feedback. If they said but today was good, then you have to replay it and see how you play the game and make it very good. So next time you go by the same. If it's flank, you go by the flank. You don't go to the center anymore. So you learn from them. So the partner is important in all of this. And we always say that let's give ourselves time. A lot of things can get the erections not working well. A malaria illness, somebody, get your car destroyed. All of this can affect erection. And normally you recover for them. I would say that in political season, if you lose an election, the first 2-3 weeks, erections will not work because of the loss. So we give you a bit of time. If after 3 months, erection is still an issue, then we need some treatment to give for it. And so that's how we look at it. But we must be quick to add that if you have had any intervention at all, let's say they're giving you a new medication to treat malaria or to treat a typhoid, or they say, your BP drug, we want to change it, or they say, you need this surgery, you need this biopsy. If you have done anything at all and then the erections start going down, then you must report immediately. You won't wait to 3 months because maybe we may have touched something. Maybe you are giving medication that is not good. If you allow it to go on for a while, then probably getting it back may be quite difficult. So if there has been an intervention, they will say that probably, we need to get reversal, we need to drop a few drugs and make an intervention to get it back. So in a jiffy, that's how we may look at the erectile function. Of course, we are able to manage it. We'll talk about it as we go on. Medications sometimes can go as much as requiring surgeries to replace it. Then we'll talk about issues with fertility. Reproductive health includes fertility as well. The erection itself is tailored in because sometimes the reason why a couple are not having children is that the man is not achieving effective erections for penetration to achieve that. Or sometimes people say that, premature ejaculation, they ejaculate too quickly. Someone will say that by the time the lady is undressed, it's all over the sheet. They can't even put it in, let alone get it to travel. So it's related. Once the erections are good, probably is a good way to go so far fertility is concerned. But when it comes to childbirth, the testes become important. Because all I was talking about was the penis and the structures. But the testes is fundamental for fertility. And in fact, we know that about 80 to 90% of the testes, as you see it in volume, is just a factory for making sperms. So any loss in the volume of your testes is loss in the ability of the testes to help you father a child. And so the testes is fundamental. So when you are talking about childbirth and fertility, we want to look at the testes. How big is it? Is it painful? Is it big? All this is a factor. Anything that affects the testes, an infection in the testis area, injury to the testes, drugs that affect the testes will make fertility an issue. For purposes of our discussions, we normally say that, things that are above the testes. The testis responds to hormones and chemicals that drives it. So if there's any hormone that is defective, we talk about the testosterone and other androgens, sometimes the thyroid, sometimes, we call prolactin, anything higher up there that's supposed to, guide the testes to behave. If they are not being produced adequately, then that's a problem. How can you tell that? You see a man and, the beard is not there. You see a man and his voice is like shrill like that of a lady. You see a man and he's too pretty than expected. Then you realize that there's something not right because he's producing too much of the female hormones, estrogens, and they are fighting against the testes. So that's higher up the testes. But the testes respond by being small or not being very, very effective. So also look at the testes. If there's something wrong with the testes, that will affect the fertility. it affects by the fact that when you look at the sperms, what they call the sperm analysis or semen analysis, you realize that the quantities are low and a lot of the parameters are very low. We'll talk about them, but we can look at the sperms and say, hey, there's something wrong. So anything that affects the testes will show us low sperms, and then that can be a fertility. When we are looking at the sperms, so far as fertility is concerned, we wear a cap that says, are there sperms or they are not? If they are sperms, they can be normal. They can be low quantities, which are reasonably low or severely low. And we also look at that, like, it's absent totally. If it's low, there's hope. We can try and manipulate and get things going. If it's absent, then that is a big, big deal. And that requires further assessment. How low would we say that sperms are too low for fertility? We will say that it is a probability game. The reality is that you need only one sperm to make a baby. So if you can see one sperm in your semen, we are okay. We are okay. You can make a baby. But the truth is that in the process of making a baby, the sperms have to travel a long distance, have to go through a lot of hazards, have to get a lot of energy to move. So the body tries to make it like a marathon, push the whole city into the road, and we are going to look for 3 people. Some will drop dead, some will get ambulance, we carry them away. So it needs so much of volume. So the more volume you have, the more likely that somebody will cross the finish line at the appropriate time and be rewarded. But if the sperms, if there are only 3, before you are aware, we have to bundle all them into the ambulance and nobody will cross the finish line. So when you see a lot of sperms, we are excited. We want to see something about 50 million per teaspoon, or call it male. If you see something like that, we are excited. It means that, hey, whatever it is, 1 or 2 may be able to cross the finish line and achieve a baby. But if it's very low, then we are worried. It means that they may not be traveled very far. Then what you do is sometimes, take them up and drop them close to the finish line. Do a few manipulations. I'm sure, Dr. Sefogah will talk about them. Manipulations that try to, get around some of the hazards and make sure that we can get 1 or 2 sperms to the target and achieve pregnancy. There are a lot of things that can make the testes misbehave. Probably for these purposes, we'll talk about the lifestyle issues. Dietary. I always tell people that the body looks at sperm production as a luxury. So if you're not eating well, enough for you to breathe, enough for you for the heart to work, enough for you to walk around, and that's what it will do. It will not help with the sperm because that's a luxury. But once you have eaten enough, exercise enough, balanced diet, keep a healthy diet, then the body has that moved to the luxury. Let's go to a sitting room and now make sure that the sperms are also produced in abundance. So lifestyle is important. Your diet, exercise, alcohol, smoking, marijuana, cocaine, anything that upsets the system, the testis is the first to hold the blood because the body wants to keep you alive and smart and sane. It will shut down the testis and keep you sane. So that's what we want to see. But any infection that drops to the testis, we call it epidermolysis, a gonorrhea, a chlamydia, especially infections, the testis suffers sickness, we lose sperm production, sometimes permanently. For instance, we know that some viral infections, like mumps, can permanently shut the testis. And when COVID came, we realized that COVID can also shake the testis to a point of virtually shutting it down. Albeit it may leave you a few sperms to move on. But we realized that the sperm count in men has drastically dropped when COVID appeared because it's also destroying some sperm. So viral infections can be very, very detrimental. We knew mumps, but COVID is also coming to play as well. So infections in the testis can happen. Trauma, injury, contact sports. I'm a boxer, I am a badminton, I am a hockey player. That can be an issue that can also affect it. So as much as possible, you protect it. And in soccer, free kick, you have to put your hand to protect it. If you don't do that, the referee will come and hold your hand and put it there before he whistles because we need to protect it. So please watch it. Watch it, how you wear it. Sometimes too tight an underwear, sometimes too tight, a jean trouser can be trauma. Okay. Sometimes we, the doctors, are the ones who cause the trauma because we are picking something from the testis or there is some pain in the testis, we are trying to analyze it and then we cause the trauma. So that is another thing. A few times it has to be with tumors or cancers. So testicular cancer can be a reason why the testis itself is misbehaving. Sometimes you are born with a testis that is not in well positioned. Because we need a cold environment for the testis to do its work for fertility. The body temperature is about 36. In our worst scenario, you have a 32, 27, 22, and it's cold. If the testis is inside you, in the abdomen or in the groin somewhere, they are exposed to so much high temperature that the sperms that are produced are virtually cooked and unwell. So we want to try and bring the testis down. Unfortunately, we know that if you are not able to bring the testis down before 2 years, by the time you bring it down, it is overcooked. You just don't get it back. So if a child is born, we want them to examine and find out whether the testis is there. When they're examining to see whether you're a man or a woman or a girl or a boy, they must make sure the testis is really there. If the testis is not there, even if one is not there, we want to do a few maneuvers, a few surgeries to bring it there before 2 years. Then we can get the testis to work fully. So in the brochure, we have looked at erection. I'm sure we'll go to details. We have looked at fertility and its importance and the fact that the testis must be very, very good. So for serious hospital infection, I must admit that now, because of effective antibiotics, even though to the point of abuse, we normally don't see too much of these infections, except when they become seeded in the prostate, what we call prostatitis. Because once the infections move from the tube, the urethra and the bladder into the prostate, they become very, very difficult to manage. And once they are there, they cause erectile problems, difficult to have an erection, prostatitis. They can cause premature ejaculation when within a minute or two the sperms are coming, or they may cause pyospermia, where they virtually make they bring some acids and some chemicals into the semen and make the sperms become very low or even absent. So when infection ceases in the prostate, then that's difficult for us. Sometimes to eradicate it, we may need as much as a month, 3 weeks to a month of antibiotics to eradicate it. So that even after a month of antibiotics, we are still left with what they call chronic prostatitis without any evidence of a bacteria, and we have to struggle to keep it going. So for male infection, please, let's treat it and treat it quickly so it doesn't drop or seed into the prostate. If it does seed in the prostate, then it can have a very detrimental effect on your male reproductive erections, ejaculation, and fertility. But they are effective antibiotics, and once we do that and it doesn't drop into the prostate, then we can be whole and dry. The last thing I want to talk about is the penis. We will say that any penis that is as long as 2 centimeters and beyond is a good penis. And that's our definition. The women get upset with us for that definition. That's 2 centimeters, we say it is good enough. I always tell people that the shorter it is, the more cash you need to augment it and make sure that the woman stays with you and it doesn't fight you, So if it's good, big enough, little money, you're okay. But small, then you have to get more cash to augment it, And so that is it. But there can be deformities in the penis. People are born with it. And so they have to do surgery to correct it. But there are effective ways of correcting them, and we do surgery to correct it. Sometimes, as part of the aging processes, inflammations and other injuries affect the penis. And one of them, we call it a Paroni disease, named after Dr. Paroni, who described it, where as you get older, the penis starts getting curved and curved. When you see it early, we can reverse it. Sometimes we give vitamin E, which is very, very effective, stop the whole processes. Yeah. But sometimes it can be so curved that the man cannot even penetrate the vagina. They may have to do a few surgeries and straighten it up. And there are effective surgeries to do that. If you are a man out listening to us and the penis is so bent that you can't penetrate, please approach us. We will do surgery for you, and within a matter of 6 weeks of excuse duty, you are ready to go in an erect position. So generally, these are the issues that come to us. Of course, the prostate is down there, and we've talked about the infections, general infertility, but the cancers and other things can also come in handy. So generally, if I enter my consulting as a urologist or genitourinary surgeon, these are the issues that we are looking at. Making sure that the penis is working well, making sure that the fertility is at its peak, and making sure that there are any deformities that are affecting urination or ejaculation or erection, we fix it up. And it's quite a busy clinic, I must admit.
Wow, very interesting. I mean, thank you so much. I'm learning a lot, and I'm getting more questions in my head. But I think that our listeners have even more questions for you. If you're listening in and you have a question based on the submission by Professor Kyei, you can send us a WhatsApp message on 055-1111-997. 055-1111-997. You can send in your questions now, and we will put them to Prof. I'm going to do the questions a bit later, but this particular question came in, and I thought that it is from somebody in Dr. Sefogah's WhatsApp group.
Be careful, be careful.
The nature of the question, I have a feeling that it is It is from Dr. Sefogah's, very immediate familial circles. I have a question for Prof. J. Is it true that bald men have more testosterone?
It's a question that we're still trying to figure out.
Still,
the truth is that much of baldness is hereditary, and so it runs in the family. There are few studies that have said that some of the reproductive cancers, like prostate, may be common in people who have got bald heads. What we are not too sure is whether it's a genetic thing, and that is it. What you know is that in trying to get bald hair, sometimes we try to actually reduce the testosterone level. A few trials that we use to block testosterone have been found in its way to get hair to grow. Because the women have a lot of hair because of their estrogens. It means that testosterone by itself, limits hair growth. In fact, anybody who has got challenges with hair growth, once you get a bit of estrogen into the system, the hair starts to grow. So we said I will not answer to it because it's multifactorial. It's multifactorial, and once it comes up, we keep.
So you are saying that Sefogah doesn't have an edge over
Lexis.
From here we will start the same.
Dr. Sam is also in that WhatsApp group.
From here we start it up. Yeah, we start it up.
Okay, so you mentioned a few things. Especially you talked about the dietary considerations as well that help with erection and whatnot. I don't know. I want some specifics, just to practicalize it, or probably to direct people. What kinds of foods or what kinds of things will help it, and what kinds will not help it?
Okay. So what we know is that we need what we call the androgens or testosterone and the hormones to help with the erection. And by their production, they are made from fatty base cholesterol. So getting that system running requires a bit of fat. So fat in our diets are important, so far we can make the androgens. So I would say that there must be a bit of fat in the diet. Unfortunately, too much fat can also be a detriment, but there must definitely be a fat. In other words, if all you take, let's say I'm a vegetarian without fat, then you may struggle with your erections because you need that fat to get the system. So generally there must be fat in the system. The next thing is that this axis requires what we call enzymes, and these enzymes work with what we call cofactors or coenzymes. I'm sorry I have to go this way because for people to understand.
Yeah.
And this depends on elements in the vegetables, carrots, lettuce, everything. So having vegetables in your diet, make sure that these enzyme systems are very, very effective. They call it the building block phase. They are very, very effective. Unfortunately, because of the way we deal with them, sometimes because of hygienic issues, most of us try to avoid them. But a bit of fat, a bit of vegetables should be able to help it. But I also said that this is an energy business. If you are fasting, you don't want to go close to this business because it's energy. The heart must pump, the muscles must work. So you can't get away from not eating well. If you want to have a good erection and a good performance, you must have that energy. For the women know it, so that they will give you the fufu before they demand. They will empty stomach. They will not worry. They will, as if they are not interested. They want to make sure that you have eaten well and rested well before they make their move. So we will say that generally be in your best shape, but a bit of fatty diet to get the system going, the vegetables to run the system, but also need the energy to complement it. So a good lifestyle, I would say that. Because if, for instance, you take alcohol and because of that you don't have time to eat and the little money is for an alcohol, then it will show in the erections. You are not taking enough fat, you are not taking vegetables, you don't have the energy. It will show as erection not working well. So when I see a man gymming and moving up, that is good.
Okay.
Water is also important because the blood must flow. If you are dehydrated, the blood is a bit sticky, it will not go. And I always see people going up the mountains and hills and there's a water bottle in the back pocket and they never drink it. No, you must drink that water so that generally the blood is fluid and it can move around. So I'll say that all the things that we do, we are brought up to do. If you do them, with all the needed straightness, you are doing fine. Too much fat is bad. Absent is a problem.
Okay.
Too much energy is bad. Absent is a problem. A balanced life, balanced diet, and exercise, you are good to go.
You mentioned alcohol, so let's touch a bit on that particular aspect of life, because some men, I believe, think or use alcohol before they perform because they have the idea that it helps them with performance. I don't know whether it's specifically for the erection or for sustaining it or for display.
Yeah. So this is a performance thing. When it comes to erection, it's performance. And there are a few things that can be inhibitory. Wife is in pain can be an inhibitory thing. You have not given enough of money, you may not want to get close. So sometimes people need some boldness to be able to approach it and forget about all their problems and focus on it. So generally, the alcohol and other things that people take is just to work on the limbic system so that you can forget your troubles a bit, the school fees, the rent, and be able to do that. So when they take it, it disinhibits them. Either the shyness or the troubles, it allows them to perform. But too much of it means that you can't coordinate, because this is a business. Coordinate. The woman is communicating with you, your partner is communicating. You must respond to the communication. So if she's communicating one way and you are communicating another way, it ends up being a disaster. So at a point, it is helpful. Beyond a certain level, it is detrimental. And you see women taking what alcohol and locking it up because you are not responding to anything that she's telling you, whether I'm in pain or you want you to keep this way or that way. So I'll say that it is disinhibitory. It can be useful, to forget some of the issues that inhibit, prevent you from achieving erection. It gives the boldness, to approach. Even though you fought in the morning, a bit of alcohol can allow you to boldly approach madam and still ask for it. Yes, but beyond that, it's inhibitory. And it goes for marijuana as well. Those who take marijuana will tell you that initially it is very, very stimulatory. In fact, sometimes to the point of even people being forced to rape because it is extremely erogenic. But beyond a particular point, then it's facility. You can't even move, you can't think, you can't even know what you're about. Somebody said that they ask you, what are you doing here? He himself managed to get you there and ask you, what are you doing here? Because it's gone beyond what's accepted. So it's a very difficult one, but that's what it is. So if the person says it is alcohol, probably it's true. But of course, it means that you are covering up the issues.
Yeah.
If you can brave the issues, you don't need an alcohol. Sometimes all you need to say, I'm sorry, and the slate is wiped clean for you to perform. But you don't want to say sorry. You take alcohol and brave your way. Probably there are better ways of dealing with the issue.
All right, great. Alcohol. Thank you so much, Professor Matthew Yamoah. There are more questions, but would hold on for now and go on to the next topic. And when we're done, then we can now tackle the questions, into detail. Before that, the ladies in the WhatsApp group have sent me a message to tell you that these 2 centimeters that you are talking about, they don't agree. They are very worried. You let the men be happy.
That's why I give a disclaimer before I
show them where to elongate it. But anyway, that's Professor Matthew Yamoah, who's a senior lecturer and consultant urologist, giving us his presentation on men's reproductive health. Now we'll go on to our second conversation about women's reproductive health, and to deliver that is our consultant obstetrician and gynecologist and fertility specialist at SHIP Healthcare Specialist Medical Center, and also senior lecturer at the University of Ghana Medical School, Dr. Promise Sefogah. Doc.
Yes, sir.
Thank you so much for coming again.
Great.
And, over to you.
Yes, I've been enjoying the professor's lecture.
Yeah.
So Lexis, for me, I'll break it down into one of the common problems affecting women, but which is also least diagnosed or least spoken about. We call it female sexual dysfunction. Okay. Unfortunately, up to 6 out of 10 women have some major sexual problem. Some do not even know they have a problem. It could be a problem with arousal. Okay. They just do not get turned on, but they have to perform sexual intimacy as a matter of responsibility. Sometimes the desire is not there. As a result of stress, it's a common big issue. And the stress could be from work overload, work demands, financial issues, And then there are some who don't have these, they're able to get into the sexual intercourse, but they never get to attain orgasm. And there's something called primary anorgasmia. That means a woman throughout her life has never experienced orgasm, so she doesn't know what orgasm is. And then the fourth one is pain during sex. And to the extent that some women have accepted and normalized that when I feel pain during sex, it is a normal thing, but it's not normal. Yes, a lot of the pain women feel during sex have some underpinning gynecological problem. Now we break it down into two parts. The pain that the woman feels in the vagina, that is called superficial, or the pain that the woman feels in her lower abdomen during sexual intercourse. Pain in the vagina in a youngish reproductive age woman most likely will be due to some vaginal infection of sorts. The pain the woman will feel in the lower abdomen during sexual intercourse results from either a pelvic infection or another bad condition we call endometriosis, both of which have very significant fertility or infertility implications. And so, if a woman feels pain during sexual intercourse, certainly there's a place to have it investigated so we can deal with it. Okay. Another thing is what we call vaginal discharge. Okay. Women's vagina produces secretions. Now, every woman has some light amount of vaginal discharge, which you consider normal. It should be clear. It shouldn't be colored. It should be odorless. It shouldn't have any unpleasant smell. It shouldn't be too much that it will wet the woman's underpants. Anything apart from these is not normal. Now, why is vaginal discharge important? It's important because if the woman overlooks what otherwise would be an abnormal vaginal discharge, goes over the counter, purchases something to insert or something to drink, the underlying cause may not have been dealt with. One of the serious problems that cause vaginal discharge is cervical cancer. And there's no way you will know that what you're experiencing is from cervical cancer or is from a severe vaginal infection, which can go up your uterus, go up your tubes, damage your tubes without you knowing. And a lot of the infections that would damage a woman's tube, in half of the time they don't give you any symptoms. So if we are lucky and you see some discharge which is abnormal, that's important for you to show up and let's investigate and deal with it. Primarily because failure to do so causes your fertility just in a few years. Now, we have the concept of age-related fertility decline. You see, a lot of women are deferring childbirth now for various reasons, including career pursuits, academic pursuits, which is great. We need women. Women are great leaders. We need women to take up leadership position, and they are mothers. They are great leaders. But the woman's reproductive lifespan is somehow time bound, and that happens because the baby girl born is born with a set number of eggs. Okay, so the woman is born as a baby girl, arrives in this world with approximately 2 million eggs. As she grows and attains puberty, when she begins to start seeing her monthly menstrual flow, she's lost about 1.5 million of those. They've died. So she's left with about 500,000, which will take her through the rest of her reproductive lifespan. Of that 500,000, every month, about 10 to 20 eggs would start developing. And then, just like Professor Chiz said, it's like a whole village you put on the street for a marathon. All of them are recruited, but one of them gets to become the dominant one, which will release the egg to be fertilized potentially. The rest of the 10 to 20, they die off. Next month, another 10 to 20 will start. One ovulates, the rest will die off. Next month. So as a woman is growing, we are losing your egg reserves. as well as the quality of the eggs, because you were born with them, unlike men who are making sperms every 3 to 4 months, right? And so by the time a woman hits age 35, she's lost a great deal of good quality and a good amount of her eggs. Whatever is left at that age becomes those of reduced quality. And how do we know? They tend to, when they get pregnant, they have a higher risk of miscarrying or having babies with all forms of deformities. And that is why we say a woman's reproductive lifespan is time bound. And so, if for one reason or the other you are approaching 30, 34, 35, and you don't see yourself settling very soon, or Mr. Right hasn't appeared yet, or you still are targeting some career or academic pursuits, fortunately we have what we call fertility preservation now, where those 10 to 20 eggs that would have gone wasted, we give some injections for all of them to develop, and then we harvest them and we freeze them. So if we do that at age 33, and you finish all your degrees, MBA, KIC, KW, whatever, and you finish all those by age 45, 46, you now want to have babies. You have 33-year-old eggs, which are of better quality, to now have your biological children. Okay, and so let's prioritize childbirth as much as we pursue our career.
Right.
For our sisters. Now, one of the problems we are seeing commonly is menstrual disorders as a result of hormonal imbalance. And the commonest is called polycystic ovarian syndrome, or let's say PCOS or PCOS. And what happens is that fundamentally, some women are born with some issues that affect how their body produces some of the hormones. And so some of the hormones are higher than the others. As a result, these women produce a lot more of male hormones. Okay. You remember Professor Kyei said, if the man is looking too fine, it's a problem. Here am I saying if the woman is looking too masculine, it's a problem. Okay. You see what I mean?
Yeah.
And so these women tend to have higher levels of testosterone. And testosterone is what makes us look masculine. So these women will have beard, and they have hair on the chest, hairy legs, hairy arms. And it can be really bad. Sometimes I saw a patient whose beard were more than yours, Lexis.
Wow.
Yes. And that goes with a lot of psychological and emotional. Fortunately, that was the time we were wearing masks, so you couldn't see it until she took off the mask. And so that is a problem. It's a problem because that woman, in about 60% of cases, do not get to ovulate. And so if a woman doesn't ovulate, chance of conception are reduced. And so she'll need some support. They tend to also develop, because she's not ovulating, she's not having her menstrual flow regularly, monthly, the inside of the womb gets so thickened, and we are afraid if it remains thickened for a long time, it could put them at risk of developing a cancer of the inner lining of the womb. They also tend to develop a lot of acne as a result of that, and they are also at risk of other problems like diabetes or cholesterol related problems in the future. And so the point is, when you have these features and coupled with menstrual irregularity, it's not in your place to say, oh, it's normal. Don't downplay it. Let's get it checked, because there are solutions. It tends to be worse if the woman with these features is also overweight or obese, because then obesity makes the condition worse. And like we say, obesity in our part of the world largely has got to do with our diet, particularly the portions. Because if you look at what we eat, a lot of it is carbohydrate rich. A lot. See the fufu, see the banku, you know. And so, if on top of that, you go and eat so much of it, you are piling up lots of calories you are not using. And so, the woman with these features who also gets obese, it complicates the condition. So, remedies are there, including weight management, we say shed about 10 to 5% of your weight. Majority of them with the irregular menses with these features bring the weight down, things improve, including fertility function. And that also reduces the risk of other complications that pertain to the obesity. Then we have pregnancy forming but not implanting at the right place. Now, if you imagine the woman's reproductive system as the body, so the egg is picked up from here. As it's traveling down, it gets fertilized by the sperm, and the fertilized egg is supposed to travel down and settle inside the womb. But some things happen where the fertilized egg gets stuck in the tube, so it's at the wrong location. That's what we call ectopic pregnancy. And problems with previous infection like the vaginal discharge, painful sex that you didn't take time to go investigate and get treated, they damage the tubes and could lead up to either total blockage of the tube or the damage which can predispose the person to developing ectopic pregnancy. Ectopic pregnancy is a potentially fatal emergency. And what it means is the pregnancy is developing there in the tubes. The tubes are not as strong and as muscular to expand and accommodate the growing fetus. So 4, 6, 7, 8 weeks, it has grown so much and stretched the tube so much that it will burst. This is pregnancy that has ruptured with bleeding into your tummy. It's a matter of time. All your blood, everybody has about 6 liters of blood. You bleed all of that and you are goner. The difference between you staying alive or dying is how soon you get to hospital and get into theater for us to go in and fix that. How do we prevent that? Don't take vaginal discharge for granted. Don't take painful intercourse for granted. When you get pregnant, once you miss your period, 2-3 weeks maximum, get into hospital. Let's start checking to confirm that the pregnancy is at the right location. Because that's the only way, if we find it early, we can deal with it before it gets so big. We can deal with it without even requiring surgery. Preconception care is when a couple are trying to embark on a pregnancy. We say visit your healthcare provider. It's important for so many reasons, but I just touch on 2 of it. Because a lot of men and women have various medical problems that have not been diagnosed. And so it's like sitting on a time bomb. So during preconception care, we talk through, we check, and then we're able to detect so many other things that require intervention just to prolong your life and improve the quality of your life. Apart from that, some have been diagnosed of some conditions and are on some medications which would require modification. We need to stop them and put them on others just so that it makes pregnancy safer. Because some medications, when you're on and you get pregnant, the babies don't form well. So we're seeing a lot of malformed babies as a result of medical conditions that were not diagnosed. Commonly diabetes. Somebody is diabetic and not complying with medication, or it has not been diagnosed, so she's put on medication. And the high blood sugars around the time of conception leads to very gross abnormal formation. The last one I saw was a baby that was formed with no head.
With no head?
With no head, and so we had to end the pregnancy. And this somebody too coincidentally who was struggling to get pregnant but did not go through the right channel, and so her high blood sugars were not detected and dealt with, and then she got pregnant. And then after 3 months came around, we did a scan. Now you're on some medication that you are not setting, so it's good to come up for what we call the preconception care. Now, you've heard of sickle cell disease. About 2% of all our newborns are sickle cell, okay? And the commonest type is, so sickle cell, you know about sickle cell where your blood, the red blood cell has what we call hemoglobin. Hemoglobin is supposed to contain the pigment genetically determined. So if you have A and A, that is what we consider normal. If you had one A and one S, it's a carrier. If you have S and S, sickle cell disease. If you have S and C, that's sickle cell disease, hemoglobin SC. And so it so happened that an AS does not know her status and falls in love with a brother who's also AS. For some reason, they are not aware, or for some reason they are aware, but they don't know the implications. Because once we know the implications, we're able to counsel you during a preconception visit that these are the options we have. Because as much as possible, we don't want to have babies who are SS, because these babies suffer a lot. They go through a lot of pain, bone pain, that makes them visit the emergency room almost weekly or twice weekly. They miss out on school. Parents are missing out of work because they have to stay home to take care of sick children. Extremely stressful. But we can prevent that when we know beforehand through the concept of preconception care. The options could be we do what we call IVF, where we take the woman's eggs, take the husband's sperm, fertilize them, and do some genetic assessment so that the embryos that are going to be SS, we take them aside and use the embryos that are either AA or AS to help you get pregnant. And so once we do that, then the couple can have normal non-sickle cell children. And that is how ultimately we can reduce the burden of sickle cell disease, because sickle cell causes complications through childhood, adolescenthood, into pregnancy, and we tend to lose them readily, quite easily during pregnancy due to pregnancy complications. Now, two of the leading cancers in women affect their reproductive organs: the breast and the cervix. We just finished making a lot of awareness in the month of January about cervical cancer. We are still seeing far too many women coming down with cervical cancer at far too young ages, and it is bothersome. Why should a woman in her 30s report with what will now become an advanced stage cervical cancer? Meanwhile, it's something that we can prevent. So we are saying the risk factors, what will put somebody at risk of cervical cancer, is somebody who starts having sex at an earlier age, somebody who does not do regular screening, somebody who is immune suppressed, whose immunity is not strong. Maybe they have diabetes which is not being controlled, or HIV, or they are on steroids for one reason or the other. And we are actually saying that when we see women using a lot of steroids for bleaching their skin, it is of concern to us, because you don't know to what extent that is getting into the system, and then the virus that causes cervical cancer is called HPV, and this HPV, human papilloma virus, is sexually transmitted, and so high risk sexual behavior. Okay, we are told that 70% of all sexually active persons are carrying that virus. Somehow, some person's body would clear it, another person's body is not able to clear it. They go hide in the woman's cervix, and this virus can be there for up to 10 to 20 years without any warning symptom for you, and then causing trouble undertone. We can only detect if we do the regular screening. Then we say, hey, there's something cooking there, let's deal with it. Otherwise, you are there and you start having abnormal bleeding. So a woman has her menstrual flow. Before it is time for the next one, she's bleeding in between. Or the woman sees bleeding during sexual intercourse. Or the woman has realized that her number of days of flow used to be 3 to 4 days. Now it's going longer. There could be other causes for this, including fibroids anyway. But then we still have that high suspicion of cervical cancer, because in as much as it will not give any symptoms in the early stage, by the time these symptoms are showing, we're probably dealing with an advanced stage disease. Or a woman who has completed having her menstruation, we say she's reached the menopause. And we say menopause if a woman has not seen her period for 12 months. So if you're a woman, you have not seen your menstrual flow for 12 months, it means you have attained your menopause. Beyond that point, you are not supposed to see any bleeding. one day I heard a woman who said, I have been in my menopause, but thankfully some old blood in me came out and I'm so happy. I said, no, that is trouble. Because if we call that post-menopausal bleeding, if a woman experiences post-menopausal bleeding, it is certainly due, in a large majority, more than 95%, due to some cancer or the other, commonly cervical cancer. And so if any of these things show up, we need to report promptly to get sorted. Fortunately, there is a vaccination now which protects the woman against that human papillomavirus which causes the cervical cancer. Before I conclude, I want us to talk briefly about maternal mental health. Pregnancy comes with a lot of psychological and emotional issues for the woman. You can imagine that a woman is pregnant, she's dealing with so many thoughts. She's dealing with the impact of her body change. You know, pregnancy makes you put on weight because the body is retaining more fluid, so your weight goes up. The women tell me that their nose has become bigger. The women say, and then they develop acne, their color changes, issues. And you'll be surprised to know that some of my pregnant women are asking, Doctor, will my daughter have hair? I don't know if it's because they see my hair and it's a problem. You know, so the woman is battling all these thoughts, okay? And then the body produces a hormone we call estrogen and progesterone, which the placenta, which connects the mother to the baby, churns out loads of that to keep the woman going in the course of the pregnancy. And so at the time of delivery, when the baby has come and the placenta has come, that level of hormonal support goes away. But this woman now has a baby to take care of. She wakes up every 2 to 3 hours to breastfeed. If for some reason she went through surgery to deliver, she's got a wound to nurse, she's got bleeding, she's got a body change to deal with. At the point where her hormonal support has dripped. And so point after delivery, the women go through a lot of they are so vulnerable. So we say women are most vulnerable for psychological, mental health problems the first 6 weeks of delivery, and that is where they need a lot of psycho-emotional support from partners, from family, from in-laws. So depending on someone's ability to withstand these, they then suffer one form of the maternal mental health problems or the other. The commonest is called maternity blues or baby blues, where a first-time mother, she's not too sure, can I really be a good mother? Oh, is that me? I've given birth. Oh, then she cries. And then that wears off within a few days. The next is anxiety. The mother has delivered and she's so anxious. Hey, don't go near my baby. Hey, no, bring her to me. That is anxiety, which is also not so big. All that requires is a bit more of reassurance from we, the healthcare providers and family, and then the friends. Then we have what is called a postpartum depression, and that is a big problem. And we just found from research that 4 out of 10 of our mothers are suffering postpartum depression, and that is of concern because a lot of it we don't even check, we don't even screen, and the women don't report them. Then they go back home, and when somebody is depressed, they are not happy. They are not interested in anything. The baby care is neglected. They don't lactate well, so they have to feed a baby formula. They don't do it well. Baby gets tummy infections. Baby is sick. Baby gets on admission. And the baby's growth and development, including their cognitive skills, are affected negatively. Worst of it, family doesn't know what to do, and they neglect the woman or take her to various places of traditional herbal places for help until things get worse. The research shows that 20% of women who died after delivery as a result of suicide, and suicide happens when there is severe depression. And so the point is, when women are pregnant, they are going through a lot, and so we, the men, we're supposed to support them. Family, in-laws, we're supposed to support them. when they have delivered and they are going through all psychological, emotional turmoil, they need support. They need psychological support so they can weather these. Some will require bringing them back to hospital for help. The worst of this maternal mental health disorder is what we call postpartum psychosis, where the woman, after she's delivered, the hormonal issues have triggered some mental health problem due to some pre-existing vulnerabilities she may have. And so the woman is hearing voices when no one is really speaking, or she's seeing things when there's really nothing there. And she can hear a voice that the baby you're giving birth to is what is making you feel like that, so get rid of the baby. Sometimes they feel that something worse than dying is about to happen to the baby, and so in order to save and protect your baby, kill the baby. And then they commit that because there's something wrong as a result of the hormonal changes of pregnancy. What we're supposed to do is detect once our sister, our wife, our in-laws have given birth and seem not to be handling well. Let's report them, bring them to hospital so they can get help. Because pregnancy is stressful, baby care is stressful. All we can do is support our women.
Wow, that's a lot.
It is.
And you covered so many other aspects of it. I'm grateful. I'd also touch on two things, if you can give us some clarity on, which is alcohol and diet as well. And especially, let's bring it to where a man comes in. Because you talked about, in the beginning, you talked about how some women have issues with even arousal and the excitement of intercourse and whatnot. Are there ways men can help, or are there things the women can do to fix it, or those things need to be medically resolved?
So yeah, there are both ways. A lot of the arousal issues would have to do with dealing with underlying stresses. Stress is the leading cause. Some medical problems can also be the cause. So stress, and a lot of the stress is from social, husbands not being supportive, what we call intimate partner violence, men abusing their partners, and then financial problems, which we are all battling, and so these are the low-hanging fruits. Beyond that, they are the medical reasons. So certainly step forward. We're able to take your detailed history and dissect the problem. We're able to say, okay, yours is from here, yours is from here. Sometimes we need to have you see the clinical psychologist. But the point is there are solutions. You just need to step forward.
And what role does alcohol play in helping or not?
So in a case of, women don't take as much alcohol as men, but alcohol generally suppresses whatever you're feeling. If you are shy, alcohol suppresses it. So if you already have a problem with arousal, alcohol suppresses that further. So it wouldn't help. It's alcohol doesn't help. And so we need to deal with the underlying problem. If it is stress and you take the alcohol, and typically it inhibits your inhibition, so you forget your problems, but that's transient. Again, alcohol for so long, that cannot be. It cannot be, because it also has its issues. We are seeing now lots of cases of stomach cancer in relatively young persons from excessive alcohol consumption and very harsh food we are eating. Harsh, salty, fermented, too harsh on the stomach.
Like what?
Can you imagine something which is salty, fermented, fish or beef? Those things are unfriendly to the stomach.
Okay.
Stomach cancer, liver cancer, breast, prostate, cervical cancer.
Is this Kobe slander?
Thank you.
Okay. Now, I didn't hear you talk much about exercise and fitness and what role it plays when it comes to women's health.
Great. So exercise is great for women. Women, some of the sexual disorders, exercise plays a role. Particularly some of the pain women have. So there's some pain that the woman has right on penetration, where the vaginal entrance is too tight. The muscles go into what we call spasm. So we teach them specific pelvic floor exercise. The commonest is what we call Kegels exercise. Kegel, if you imagine you're peeing and you have to hold it. So you toughen your pelvic floor muscles to stop the pee midway. So if you imagine doing that repeatedly 5 to 10 times in a minute, and then repeating the cycle, that helps to strengthen and relax the pelvic floor, and that helps that type of sexual disorder. Same exercise helps women have smooth vaginal delivery without suffering tears when the baby is coming. It also helps after delivery. So the birth canal is very dynamic and elastic. So as the baby comes through, no matter how big the size of the baby's head, and then after that you expect a bit of laxity, but with the Kegels exercise it brings it back with time. Okay, because if you don't do that, then later on the women tend to suffer what we call pelvic organ prolapse, where the vagina or the womb is sagging through the vagina down. There's also another exercise we call perineal massage, where the woman is supposed the perineum is the space between the vaginal entrance and the anus. So the woman puts the finger in the vagina and the thumb there to massage the perineum. That helps greatly to improve some of these sexual function disorders, as well as strengthen and then support the pelvic floor for labor and delivery.
Okay, well, good stuff. That's some very good information out there. If you're listening in, this is our health and wellness series, and we've been having a very, very important conversation about men's and women's health. You just heard Dr. Promise Sefogah, who's a consultant obstetrician and gynecologist. You also heard earlier Professor Matthew Yamoah, who's a urologist, a consultant urologist. Now, I'm activating the phone lines now. I know a lot of our friends have questions or they're seeking clarity on anything. It could be your issue, or it could be any of the things that my resource persons have spoken about. You can call us on 0302 216 541, or you can send us a WhatsApp message on 055 1111 997. You can ask any question about the things that we've spoken about this evening, or anything that you need clarity on. Okay, if you're on our live Facebook page as well, you can put your comments or your questions in the comment section, and I'm sure the team will put it up so that we can actually throw it to our resource person. So the number to call is 0302 216 541, and our WhatsApp number is 055 1111 997. I got a message from Johnson in Bolgatanga earlier, and this one I think that Professor Kyei, you would have to look at this for us. Good evening, Bill. I want to find out from Prof, how dangerous is masturbation to one's ability to reproduce, especially if it is on a repeated basis? Thanks for the education.
Okay. So, masturbation depends on the reflexes that we talked about, and it's manipulating the genitals just for pleasure. Okay. The reality is that one starts in a small way, but then you realize that what you need to stimulate you gets harsher and harsher and rougher and rougher. It will also take longer. Previously, maybe just 10 minutes, you must have realized that pretty soon it's taking longer, 20 minutes, an hour, and 2. What does it do? The first is that it can reset the whole system. I know a gentleman that, the wife came and complained that, husband ejaculates after 1 hour, and I'm tired and dried, and I just can't take it anymore. I engaged the man, and he admitted that it's masturbation. And for some time, he had to start vaginally and has to go and complete by masturbation because he has reset the whole thing. So it resets your whole psychology, your whole nervous system to something rough and harsh, and can be very, very detrimental. That if you intravaginally, where you need the sperms for babies, you can't be able to produce. Now, at the point of orgasm, it can be rough. So people lose the ability to control themselves. So there are injuries. So sometimes you can end up with what called strictures, injuries in the urethra, and then, scars in the urethra, which you have to try and open up, and sometimes you open up and it doesn't work well. So they can't even know. All they know is that now I'm married and the sperms is all dead. We call necrospermia. And you do investigate, realize that because of the squeeze and pushing it in different holes, things have been destroyed. And so it can also affect the tissues of the penis itself, and then erection becomes a problem. So generally, it resets you in a bad way, so that sometimes your partner cannot tolerate. You want it rough, you want it hard, and the woman is running away, and so you want to have a child, it's not possible. Or it damages the tube, because the penis, there are about 3 tubes in the penis. You call the corpora cavernosa from back. They are very firm and strong. You can hardly destroy it. But the one that contains the tube for urination is very soft and very friable. And so if you squeeze it together with the hard ones, by the time you finish, the soft one is all mashed out. So it's quite detrimental. It resets the system badly and it causes damage to the penis, and that can be detrimental.
Okay, thank you so much, Johnson. There you go. Now Felix is on the phone. Hello, Felix.
Hello. Yeah, hello. Good evening.
Good evening. How are you?
I'm fine. How are you too?
Well, thank you so much. You're live on air. Let's hear you.
Yes. I just wanted to find out something. I did some semen analysis and was diagnosed of azoospermia. I had to do it again at the same place, and they said that is it was the same result. I wanted to find out how I could be helped.
Yeah. Okay. So as we said, there's a continuum of sperms being bad. And
What was the condition he mentioned?
So he mentioned exospermia, which means that for his case,
exospermia.
Yes, for his case, there were no sperms at all. And I think the right thing was done. When the sperm analysis comes as the first time and there's a figure, we normally want to be sure about it. As we said, a febrile illness, a drink, a few things can cause the sperms to misbehave. So normally we may repeat it another 3 weeks or sometimes even another 3 months to make sure that whatever may have upset the system is not still there. So if the sperm analysis have been done twice and they say that it's exospermia, so if the separation between them is more than 3 weeks, 3 months, then it is true. That means that in the semen they did not form any sperms at all. Then we have a question to answer. We want to go back to the testis as the factory. Is the testis making sperms and they are not being pushed out, or the sperms or the factory is shut down? So that's what we have to answer. How do we answer that question? Sometimes we do what we call hormone axis. So the body itself has its own antennae for picking up things that are wrong with the testis. If the body realizes that the testis is not behaving too well or not living to up to station, it drives it to some chemicals, what we call hormones, to drive it, to get it to behave. So if you do this hormone test, FSH, follicle stimulation hormone, and the prolactin, the luteinizing hormones, we do some testosterone level, and there's evidence that the LH and the FSH are high. It means that the testis has recognized that the factory is not doing good and is trying to drive it. So that gives us the trigger that maybe it is a primary testicular problem. If those figures are good, then we are suspect that maybe the testis is doing well, but just that the factory is good, but the outlet or the road or the bridge is broken, and so it's not coming out. And this happens if, for instance, I've got a vasectomy. For instance, I've got an infection or something that has destroyed the tubes, or as I said, you have caused some blockage within the urethra, then this can be the reason. So if we establish that the body is relaxed, the body is not driving itself, the body is at ease, then probably the factory is doing a good job, but maybe we are not pushing the sperms out. So one of the things that we do after these blood studies is what we call a biopsy, where we take a bit of the testis to see how the factory is behaving. If we take it out and there are sperms in these good forms and various forms, then we say this is an obstructive azoospermia, something is blocked. Nowadays, normally we don't want to just pick it up and throw it away. We normally want to work with the fertility doctors and embryologists, so that when we pick it, we still keep some so that we don't have to come back again to continue to manipulate the testis. So the biopsy can be very useful. However, if we think that the hormones are high and it's a primary testicular failure, then when you decide to go and explore the factory, then it's mandatory that we get some of it to preserve, because whatever we're going to tease out may be the only sperm that we can ever find at all. If you decide to go to the next step of fertility, then we need to do it in the context of that. And the little we find, if it's one or two, we must preserve it for the fertility issues. So it's a challenge. Where we are is a big challenge.
But he can be helped.
It can be helped. It can be helped, because sometimes we find out that there's a blockage that we can even reconstruct it. Sometimes the person, something in the vase, we can identify the location and re-put it together.
Okay.
But it can be helped, and I think that he needs assistance.
Okay, so I think that maybe Dr. Sefogah would have to take a perspective on Johnson's question about masturbation, because one of our friends is asking, can you ask about female masturbation as well? Mostly people speak to masturbation in males. Is it because there are no harmful issues with it when it comes to females, or it's just not widely spoken about?
So let's situate this. Good sexual intercourse is extremely important. So it's good to drive it boosts your immunity, good sexual pleasure. It lowers your blood pressure. It makes you, and so that controls your heart rate, improves the health for your heart. It makes you look younger, and improves sleep. So there's an important place for good quality sexual experience. It is when people don't get that, then females resort to masturbation. For instance, where they stimulate themselves to get an arousal. But that resets the nerve endings in the pleasurable point, so then it becomes difficult for the natural penis to get them there. So that's the danger of it. Apart from that, we get concerned about infections, because those female who do masturbation with their toys, they tend to come down frequently with vaginal or we call genital tract infections. So it's got dangers. So it's best avoided. If someone is so hooked on it, it affects their sexual life. Otherwise, you have to get a clinical psychologist or a sex therapist.
Okay. I think I have Pearl on the phone now. Hello, Pearl.
Hi. So I'm calling to ask, aside you getting a donor egg when you have low AMH, is there any other way out?
All right.
I'm lost on this question, so
Yes,
you can break it down.
I'll find you.
Yes.
I told you the woman's egg reserves drop as they grow. So the half from the egg is from the donor's DNA.
Wow.
Plus your partner's own.
Yeah.
But of course, you carry the baby, you give life to the baby, you nurture the baby, you function as a mother.
Okay.
Yeah.
But the DNA,
the DNA, yeah. But you have a baby. You have a baby.
Oh, well, anyway.
Yeah, you have a baby. And the same way, we also encourage couples who wouldn't go that route. There are lots of children in the foster homes who need homes to be brought up in.
Yeah.
Yeah. So that's
well, you have a baby until you're applying for a visa and they ask for a DNA test.
Yeah, and we declare it beforehand.
Okay.
Yes, so we do a letter for you for the embassy. It's not a big deal.
Okay.
Yeah.
Oh,
yeah.
Interesting.
The same applies to the surrogacy.
Okay.
Where if for one reason or the other, the woman cannot carry the pregnancy. Maybe she suffered some bad fibroid or other conditions, so her uterus has had to be removed, or she gets repeated pregnancy failures, or there's some problem with her uterus, so she cannot carry. We take her eggs, take the partner's sperms, form the pregnancy, and then the third party will carry for you, and then give of the baby to you. Everything is legally documented. And
wow.
Yeah.
I didn't know that.
Yeah.
Okay,
solutions
that's
for every problem.
Yeah.
Much.
I think I've got Lincoln on the phone. Hello, Lincoln.
Yes, sir. Good evening.
Good evening. Welcome. Let's hear you.
Yes. Good morning to my colleagues there. I believe all of them are doctors.
Yeah.
Are they doctors running a hospital or clinic? Or they are just educating us this evening? But I'm enjoying the program.
Okay, that's good, Lincoln. My panelists are urologists and gynecologists.
Okay. I appreciate all that they are doing. In fact, I'm happy they don't create any fear and panic, because they are telling us the fact. Some of these herbal medicine, herbal doctors, they are just creating fear and panic in this country. So I will urge them to I hope they will be coming every week so that some of us can listen. And my brother, things are happening in this country. Some of us. So I will urge them so that they will, if every week or once in a month, they will also listen.
Okay.
And if they have a hospital or clinic, they have to give us the direction so that if we can afford to come there.
Lincoln,
bro,
I get an impression that you have a specific issue yourself.
Oh yes, I have some problems that I want to contact some of these people. I don't want to, excuse me to say, anybody running a herbal hospital or this thing shouldn't be offended. I want to go to these gentlemen so they can address the problem that I have. I prefer going to them, though the English they are speaking is very, very expensive. So I don't know their clinic or hospital will also be expensive like that.
Well, Lincoln, you have the opportunity to get a bit of guidance for free. You might not want to go into detail, but is there a specific topic that you need clarity on? Maybe they can speak to it for the benefit of the general public as well.
Oh, I know by all means, maybe at the end of the program, they will put out their numbers or something like that so that we can contact them for further education.
All right, that's fine. Thank you so much for calling, Lincoln.
Right.
All right, that's Lincoln there. I got a message from Richard who says, I'm 54 years and I'm active, but I don't feel for sex as my wife does. And that's because she doesn't get very wet. And I feel like I'm hurting her. What do I do to make her happy?
Okay. Thank you very much. I think, I mean, the age gives it away. I'm a woman at 54. Depending on her, family.
I think he said he's 54.
He's 54.
Yeah, he is 54.
Oh, okay.
But maybe plus, or maybe minus a couple for the woman.
That's right.
Maybe.
Yeah. So once women get a bit older, they get a bit drier because the estrogens and hormones are a bit low, and the secretions that Dr. Prof and Sefogah talk about, get a bit lower. But there are lubricants that are very good. And some of them actually been designed specifically for sexual intercourse. They are different from the Kyei gels that. So I think that could be very useful. Something he can apply or the lady can apply before intercourse. And I think it's something they may consider.
Okay.
Because it's pleasurable when your partner is enjoying it. Definitely, if the person is not enjoying it, I'm not sure he is either enjoying it at all.
Yeah.
Okay. So you should go for a lubricant, and they are very effective.
Now this question here says, "Hi, mine is to Dr. Promise. Now, my doctor has been saying that I have a lot of androgens, which is why I have been diagnosed of PCOS or PCOS, where my symptoms are severe hormonal acne, which I have been placed on a contraceptive, and at the same time, my dermatologist is giving me a medication to treat my acne. I don't know what caused this because I had a very smooth face when growing up, and I wonder how long it will take to treat this. Can Dr. Promise explain it more and advise me? Please, people say if I give birth, it will go. How true is this? Can I do something about it?"
Yeah. So you see the bit about you used to have a smooth face and then this happened. Chances are that she has put on a bit of weight. That would be the trigger. But the question as to what caused it. So you were born with that tendency to have that PCOS. You were born with it. There's some dysregulation of the hormones from the point in the brain, and so the things we do in order to prevent it from manifesting are keeping a healthy weight, including minimizing our intake of animal products. So minimize your intake of meat, egg, cheese, sausage, bacon, milk, all the otherwise sweet tasting things. This is what we always say. And then with that, and you try and bring down your weight. The hormonal contraceptive pills, we use them to try to realign your cycles, but you cannot be on it for so long. Unfortunately, this is not one of the things that after childbirth it will go. The thing that commonly improves after childbirth is one of the forms of severe menstrual cramps due to what we call adenomyosis, but not the PCOS. And so keeping a healthy weight and managing your diet would be important for you. A lot of patients who, I saw somebody yesterday, her periods have not come for 3 years, and she admits that yes, I have put on a lot of weight. And so we get on the weight managing scheme and things would improve. So watch your weight, carry on with the medications, and then things will improve.
All right, let's get on the phone line now. We've got a friend here. Hello.
Hello, Bill.
Yes, sir. How are you?
I'm doing well, yourself.
Okay, I'm well. Thank you so much.
Greetings to your panelists.
Right. Yeah. Let's hear you, sir.
My problem is I'm 43. Hello.
Yeah, say that again, please.
I said, I'm 43 years.
43.
Yes.
Okay.
And I'm a father of 5. And nowadays, I have a problem which previously I'm not like that. I function very well on bed. But nowadays, it's like the moment I go to bed, then I release. And I don't know where the problem is coming from. And though my wife is not complaining, but within me myself, I'm not feeling good because I know previously that's not how I am. And now, and even I have been operated of hernia before giving birth. I think that was about 15 years ago before giving birth. And secondly, too, I'm a driver, and so I don't know if it's because of the sitting down. And so I want your doctor to throw more light on it for me. It's because even tomorrow I'm deciding to visit the doctor at Tema, because normally the Tema General Hospital, the specialists come on Tuesdays. But because we are on the radio, maybe somebody will not have the opportunity to be going to the doctor. So as far as they are there, they should educate us more about I don't know if the problem will be the driving or the sitting down or whatever it may be.
Okay.
Thank you.
Thank you very much.
Good. So, I mean, what he's talking about is, you call it a premature ejaculation. And I would say that per our basis, we say that every man should be able to stay in the vagina for at least 6 minutes before they release. I always say that. I always say disclaimer because the African woman will be upset with me. But that is our objective way of assessment. If you can't stay for 6 minutes, then that is a challenge. At his age 43, he is quite young, so we expect him to be able to stay on. One of the commonest causes of releasing too quickly is on the premise that the erection itself is not strong enough. And so the question is, how good is the erection? So that all the things that we talk about that can affect the erection. He's a driver, tiredness, 4 or 5 children, the stress, involved, trying to keep. All this can be a reason why the erections are not strong enough. Because once the erections are not strong enough, it is very difficult to gauge and to be able to be in control. Let me put it that way. Okay. Maybe probably he doesn't have time for exercise because he has to drive around town, So food, good nutrition, exercise, less stresses should be able to get the erections to be at its peak. And when the erections are peak, then you can be able to gauge your way through. If the erections are good, then the question is, why are we releasing too quickly? One of the important things is, infections, especially around the prostate area, called prostatitis. So what you want to find out whether is there any pain on passing urine at any point in time. This can be an issue. You want to find out what is happening in the area. Is there an infection there? He talked about sitting for too long, not that we are aware of. At best, it's a back pain affecting the nerves, and erection then becomes an issue, but not probably the ejaculation. So that's what I would say. Going forward, there are medications that we can give to deal with this if the erections are good. Only that one. There are a few medications that probably once a week is all that you need. So we'll ask for a good erection, we'll ask to treat an infection around the area, and then if these are not helping us out, we might put the medication that we need one a week or two to do with that. When the body resets itself, you realize that probably doesn't need it anymore. So that's what I would say, but it is manageable.
Okay, that's good. And we've got Felix on the phone. Hello, Felix.
Good evening.
Good evening. How are you?
I'm doing well. By you?
That's good to know. We're well. Let's hear you.
Okay, so I want to know how spondylosis affects erection.
Spondylosis.
Yes, spondylosis.
Okay, so we said erection depends on the nerves, especially the one that requires maintenance. But even the sarcogenic, they must all run through from your brain. They must run through the nerve that pass through your spinal cord, and they get to the penis to achieve the erection. Now, if you say you have got spondylosis, there are various grades. But in the severe one, there's pressure on the nerves as they exit the spine. And so once you put pressure on the nerves, they become weakened. They are like electrical cables. So if you're supposed to have 3 cables passing through and you end up snapping one of them, you're left with 2. You realize that you get doomsday or some lights are flickering, or the fridge will not work, or the television will not work because the power passing through is weaker. So spondylosis in its severest form, when the nerve roots have all been trapped, then the impulses or the nerves cannot travel to the penis, and that can be the challenge. How do you go around it? Sometimes we try to improve the little nerves that are left. So you see, give you vitamin, B strong or the B12, to help the situation. That can help us, the vitamins. Sometimes we get the neurosurgeons to come in, injections here and there, a surgery there, a corset here and there to take the pressure off the nerve roots, and that can be helpful. So that's what I would say. Okay. While we are talking about spondylosis, those who get diabetes, called diabetic neuropathy, nerves are weak. They can also undergo the same challenges. So the nerves can be an issue. Good diabetic control, good spinal hygiene, and of course getting the neurosurgeons and orthopedists to help you can help.
Maybe you might want to throw a bit more light, because Notte wanted us to ask you, Prof, if you could highlight on the impact of hypertension and diabetes on male reproductive health.
Okay.
If there's any bit more you can share with us on that.
Okay. So the 2 basic needs for a good erection is blood supply and nerves. Now, blood supply, because the fluid that comes to the penis to give it that rigidity is blood. And this is the blood that we are mopping from every area, from your heart, from your leg, every area is part of the blood volume that we talked about. So the blood must get into the penis. And once it gets into the penis, then we can get the erection. Anything that impedes blood flowing to the penis can be a challenge. We can start from the heart. If the heart is weak, you can't force the blood in. Because at the peak of blood in the penis and its pressure is about 300 millimeters of mercury. And what is in the heart? Your blood pressure is 120, 80. So you need that basic one to come to the penis, and the local systems will then push it up to that level. So if your blood pressure is 70, 40, then we are already in a losing end. To come to that 300 is very low. We said that the blood volume or pressure depends on your heart rate and the power behind it. If the heart is poor, it beats 1 and it stops. 2, 40 beats, 45, it becomes a challenge. So you need a very good heart to be able to do that. You get a heart attack and some part of the heart muscles are died off. You can't generate that kind of pressure to transmit some of them downstairs. Maybe enough to keep alive, but to put some there to get the pressure may be low. So the blood is in heart. And the blood vessels. Hypertension with time causes what we call atherosclerosis, where the blood vessels become thickened. And together with high fatty food and lipids, fats are deposited there, so that the blood vessel becomes clogged. So it takes a long time for the blood to fill the penis. By the time it fills it up, the woman has given up on you and left altogether. So we want to keep the system efficiently running, and hypertension can cause clogging. So exercise and things can help clear the pathway so the blood can quickly flow in and quickly flow out. We talk about the nerves. Even the blood vessels relaxing or expanding are controlled by nerves. The skin around the penis, which carries all the impulses of pleasure, are carried by the nerves. So like somebody said, if the nerves are being compressed and the impulses are not traveling in, then that's an issue. So the spondylosis, the diabetes, spinal cord injury, you've got the road traffic accident, the nerves have been severed, you've got a surgery, prostate surgery in the pelvis area, rectal surgery, radiation for prostate cancer, radiation for cancer of the anus or the rectum. All of this interferes with the nerves and make them not be able to carry the impulses that they have to carry. Sometimes they recover, but once the nerves get damaged, it takes a long time to recover. So good blood vessel and blood health, good nerve health is fundamental. And of course, we talk about the quality of the penis itself and its structures within. Okay. So they are quite fundamental. So poor diabetes control, poor BP control can be detrimental.
Okay.
But I must also say that sometimes the medications we give, especially for the management of hypertension and the high lipid, can also be the cause of the problem. Because sometimes we give them to lower the heart rate, and that can also make it difficult to push the blood. Sometimes we give them to expand the spaces so that the blood pressure drops. And as I say, if the blood pressure drops, then also the pressure you build in the penis also drops. The interesting thing about these medications for hypertension is that they are very, very erratic. One person will say this medicine is the best for me. My erection is good. You give to somebody in the name of erection and he said this medicine is terrible. Then the other person which was bad, you give to a person, he comes back and said, hey, this extra for you. You have solved my problem. You've changed the drug. So you talk to your doctor. This hypertensive medication is not too good for me. He will make a change. But if you say that, tell a doctor that which of the medicine is good for you, it's quite difficult. Because when you say this is excellent, another person comes and is bringing his pack and says, please take your medicine. It's not good. Talk to your doctor and they'll make the changes.
So with the flow of the blood, right, you say, normally you have to amass the blood from all our parts of the body to accumulate in the penis.
That's
right. So sometimes even from the heart and things like that.
That's right.
So it's more like a trade-off, eh?
Oh,
so can I decide and say that the heart can relax? Let me. I need a blood down there.
Oh, yeah, it's quite a trade-off. But the reality is that the amount of blood you need is not that much because there are local mechanisms that make it efficient.
Okay.
So the blood comes in there are contractions. For instance, when the blood comes to the penis, the veins that's supposed to carry the blood out are shut down. We call it the venular system has compressed. So the blood stays there until you are done. Then sympathetics are released and then the veins then open up and then flow. So it's a whole mechanism.
Okay.
But the blood must come there. But they get trapped there by other mechanisms. Sometimes it's the trapping is the problem. Especially people who have got damage to the penis. You call it penile fracture and things. Then the mechanism to trap the blood is not there. So it rushes in and before you can say Jack, it's all gone. But the system is like that the blood that comes there, it shuts it there. So you don't need to empty the whole heart and put it there. The little that comes down, it shuts it down.
It's
yeah,
fine,
okay.
it's fine.
But
It can be emptied.
the blood yeah. But a lot of fluid, and we don't want to get
The
dehydrated.
other part is very important too.
So
Anyway. Let's read some of the messages. Lots of messages are coming in. I'm actually hoping that we can be able to tackle all the issues that we are hearing. We're getting in here. Good evening. My monthly flow is very regular. I'm 46 years and have been with my husband. We've been having regular sex, but the past 8 years I've not conceived. Is there a problem? And that's from Emerald.
Yeah, so Emerald, if you have regular intercourse with your partner, and where to as regular, assuming you're able to tell when you ovulate or not, you're able to meet up at least 3 times a week for up to 1 year, and there is no pregnancy, there's a problem. If you are 35 years and above, and you do this, and for 6 months there's no conception, there's a problem. So you have stayed with that for 8 years, there is really a problem. But the good thing is there are solutions. Either the issues are having to do with your egg reserves because of your age. It could be due to your tubes. A lot of our women who are struggling to conceive, the problem really has to do with the tube because of past pelvic infection that they may have had that they didn't know about, and then this went up and then blocked, damaged the tubes. Some of the time we're able to flush these tubes to open them back so they can have the sperm and the egg meet. Or if that wouldn't work, then we have to do the function of the tube, which is fertilization, outside of the body, which is what we call the in vitro fertilization. We take out the egg, take the sperm, form the pregnancy in the specialized laboratory, and put inside your womb. Worst case scenario, if we check and the egg reserves are way too low, then we look to what we call the donor egg. So there's certainly a problem, but there is certainly a solution.
Yeah, okay.
And the problem could also be from the husband.
Mm-hmm.
So I agree with Pamela, there is a problem. And sometimes getting the husband to do a few sperm analysis could also help, whether he is also contribute to it. Because almost about 50% of cases, the man is also part.
Yeah.
And we found even about 75% of the couples coming with difficulty to conceive, 75% of men in this are the cause. But we are in a society where we have conferred some cultural, diplomatic immunity on the men. Anything infertility, everybody is pointing the women, stigmatizing them, but they have to come together. Men are a big part of the problem. Yeah.
Somebody's asking if there's a way to reduce testosterone levels in women.
Yes, there are. Once we confirm the levels through blood tests, there are ways, sometimes medications, and in very few cases, some minor surgical procedures. So there are ways we do that.
All right. And this one to you says, I'm recovering from a stroke. My nerves on my left side are affected and my erection is getting affected. How do I reach you, Seth? Okay, Seth, well, I'm sure when we're done, we'll put out ways you can reach our specialists here. And Theo from La says, I'm told by my doctor that I have asthenospermia. After doing a sperm analysis, what can I do to help myself?
Okay. So there are various parameters of the sperms. Similar, now we do the semen test. We have the volume. At least might be at least 1.5 mils. The average person may be making about 3 mils, 2.5, 3 mils. So the volume is one thing. There is acidity or the basicity. That's also we call the pH. It must be about 8. Then we talk about the count. The count, as you say, whether it's absent or there are few per million. So that the average must be at least you must have more than 50 million per mil. Or if you take the whole sperm together, you must have at least more than 40 million. When you say put it together, we take the mils, the number of million per mil, and multiply by the volume you have made to arrive at that. Then we have what we call motility, how much they move. At least we expect about 50% of them to move, whether it's rapidly or sluggishly. So that is how much they move. They also talk about how they look, whether they look like a rare sperm. A sperm must have a head, must have got a mid piece or a neck and a tail, So if they have got a head and there's no mid piece, that's a problem. If they don't have a tail, that is a problem. So when we use asteno and all those things, sometimes we combine all the features such that maybe the motility is bad, maybe the morphology is bad. But the truth is that we have got a minimum that cuts across. So 4% morphology, 50% motility, and so we're able to put it across. So they'll tell it all. They'll wear stenospermia, but we look at it and see which is the issue. Or they'll say that there's no sperms, or they say that they are necrospermia, they are dead. So you shouldn't be worried about the big word that they are giving, because the truth is that if you have got 80 million sperms and they write that after you have taken all the bad ones, realize that you still have enough sperms to get a baby. So we look at the term, but we look at of what proportion that are that bad, and realize that you still have enough to solve it.
All right, I think I've got Joseph on the line. Hello, Joseph.
Well, Lexis.
Hi, how are you?
I'm fine. How are you?
I'm well, thank you. Let's hear you, Joseph.
Greetings to Prof and then Dr. Promise.
Yes, sir.
Well, I've really enjoyed the show.
Thank you.
It's so educative. But then, I have this one question I want to ask. Has hernia surgery had so much impact on erection? I wanted to ask Prof for me, and to what extent? Also, you were making a point that sometimes men use alcohols for sex, and Prof was trying to evade it, and resorted to the fact that they just want to, forget about their problems and all of that. How about certain times we associate certain alcohols as a form of aphrodisia to, use our libido to perform? It has become increasingly, so much on we the young men. You should educate us a little bit on that. Thank you.
All right, Joseph, thank you so much. Okay, so I think the first bit was about whether the hernia surgery. Yes.
Normally, a hernia surgery should not affect erection, because where we do the surgery, the nerve that pass through there normally does not contribute towards erection at all. And the blood vessels that go for erection of penis, they don't pass close to where we are. Probably what is triggering or precipitating the hernia may be the issue. For instance, it could be a prostate problem, which on its own can have effect on erection, because there's a cancer or there's an infection or something. Sometimes it could be constipation, other erectile issues where the nerves could be affected. Maybe it could be work related. Maybe it's a hernia because you are doing heavy duty and you are ignoring the back pain that we have, which we talked about. So generally, hernias should not be able to cause erectile problems at all, except maybe probably what has precipitated them. However, for fertility, a tubes that carry the sperms for the testes passes through the same area that where we do the hernia surgery. So sometimes in the course of the surgery, inadvertently, we may end up damaging the tube. So if you say that I've got a hernia surgery and my fertility is low, then I may be looking at putting the two together. And so that's, but not for erection, but fertility, we can put them together. For the alcohol, we won't consider alcohol as aphrodisiac, not in our traditional medical literature, and I don't think that even in our local we do. If you don't talk aphrodisiac, they may have added something to it, a bitters. There's always comes to a bitters whereby one herb or one tree bark has been dropped in as a that. But we also agree that it is disinhibitive. We say that that's what they used to say. It's disinhibitive. So yes, I think that is where it works. But if they have added something to it, then probably that is the content, the additional, that is aphrodisiac. But it's disinhibitory nature, or allow you to speak your mind and perform. That one is well established, and people trade alcohol for that purposes. Please, if you want to go and speak and you don't have the courage to speak, there's something small that you pick it from your pocket and take it, and then you can speak to the situation. You're going to propose, you can make it. Please pick a little bottle, and then you can tell the lady your peace of mind. So we know about that one.
Okay. We're totally almost out of time, but I'm seeing like gazillion messages and their calls keep coming in. I don't know whether we should take a call now, or let me just read these messages here. I think Ophabia sent a message earlier when we were talking about the sickle status, right? And she said, please ask him about the C and also the AC. I only got to know this from neonatal tests on a baby born in the US. Apparently, people with the C cannot also marry an S person. Is there something of the sort?
Yeah, I mean, so the abnormal hemoglobins can be S or C. And there are some minor forms we call thalassemias. So S and S, that we call sickle cell disease.
Right.
SC is also another form of sickle cell disease. AC is a carrier status. AS is a carrier status. So it is not true that somebody who is S cannot marry a SC. They can. Just that there's a high likelihood of having one of their children who will be SC. The SCs are not so much of a problem like the SS when it comes to the complications such as the crisis. The SCs who are men hardly have crisis, but when they are women, then they tend to have crisis during pregnancy. So it is not true.
Okay.
Yeah.
All right. Would keep the responses quite brief because we just have like 5 or 7 more minutes to wrap up here. Queen is asking, what about bleeding during sexual intercourse, especially your partner putting his fingers into your vagina? Please, your advice.
So bleeding during sexual intercourse is a warning sign that there is something wrong. The most dreaded one is cervical cancer, because in that case the cervix is the tip of the womb that is sticking out into the vagina. So anything that touches it provokes bleeding. Could be the finger, it could be the penis, or sometimes you go to hospital, they do an examination, vaginal examination, it provokes bleeding. So that is what we don't want to sit on, and so it should be promptly reported. There could be other problems like an infection, but that is not in your place to determine.
Okay. Dr. Sefogah mentioned that as a woman, the discharge shouldn't be too much as to wet your undergarments. But does that apply when one is ovulating as well?
So when you're ovulating, the natural discharge increases slightly, but it's just clear and also a bit stretchy. It happens to allow the sperm to be able to pass through the birth canal to reach the egg. So it is allowed that at the time of ovulation it goes slightly more and it's a lot thinner. That is normal.
Okay.
But any other side of your cycle, when you see plenty discharge, is problematic.
Can you please ask for me? I keep on having a fishy smell in my vagina. Meanwhile, all STI tests came out negative, and I don't know if it's from my husband because he is being diagnosed of syphilis.
Syphilis is a sexually transmitted infection. So both partners get treated if one is diagnosed of syphilis. So I recommend both of you get treated. The fishy smell actually connotes a particular type of vaginal infection which has treatment. So you should be able to get treated and you'll be fine.
Lydia says, I'm always dry and have pain during sex. I have seen my gynae and I have been given medications, but I hardly get wet during sex. And even if I discharge within a short time, I'm dry again. It makes me not enjoy sex at all.
There should be a place to take a close look at your hormones. It may have something to do with your hormones, and so we find the underlying hormonal issue, and we should be able to help you out of that so you can have pleasurable sex and all the great benefits there is to it.
Some 7 years ago, my son contacted mumps and he was treated. I heard Prof say that it causes fertility issues. What should I do, please? That's from Marianne in Tema.
So when it comes to mumps and fertility or its effect on the testes, we have what we call pre-pubertal and post-pubertal. If a child gets mumps or kyei and before puberty or maybe before 14, 13, it never affects their fertility issues at all. However, if you get to post-pubertal, so you are 22, 23, 40 and you get the mumps, that's where you have the most effect. So if you didn't give the age of the child, if the child was before puberty, for 12, 13, 14, probably shouldn't be worried at all. Yeah, but we also don't say that anybody who gets the mumps gets it all isospermic. No, I mean you should take it easy. It's a probability game, but it's still good to let the child know this has happened. So in case later on get married and they have fertility issues, as part of the story, it can be brought on board.
So there's this issue of women using cloves to either clean or tighten the vagina. They say they do that by boiling the cloves, pouring the water in either a bucket or a container, and having their private part well positioned just to allow the vapor, as it were, or the warmth or whatever it is, into the vagina. How true and healthy is this practice to a woman's reproduction?
Add the name of the person
From Johnson in Bolgatanga, yes.
Asking for
Again.
Yes, I mean, we are aware cloves have natural remedies for some of this, improving pelvic floor muscles and then tightening or enhancing the health of the vagina. Indeed, I've heard that some people use it to steam it like he described it. I have not found harmful effect, but you want to be careful when you're steaming because of the dangers of the heat. Otherwise, a natural spice that we use and should not be of any major medical concern.
Good evening, Lexis. I'm afraid to have intimate sessions with my wife because even if I cough, she becomes pregnant. I have tried all the products, but still, is something wrong with me because this is too much?
I mean, I will let Sefogah speak. He should come and see me. We will offer him a vasectomy and block it from dropping at all. Because he can't have first. You have to cough. You have to cough. So let's do. Yes. So we can do something on the tubes, and it's very, very effective. Because important. Sometimes the woman cannot use the other method because of one medical reason or the other. So we shouldn't really look at the woman trying to solve it. I know Sefogah will come to how the woman can solve it. But I think that from my perspective, I think the man should be in charge.
I've always thought about this vasectomy topic because, and it's sad that it's coming up only at this tail end because it's one topic that we really need to delve into it. Because especially when it comes to the contraception conversation and birth control conversation, all attention points to the women. Some men don't want to even have the vasectomy conversation at all.
That's right.
Even though they say they don't want to have children.
Yes, for him, I think he should take the
So with the vasectomy conversation, maybe briefly tell us, is there a problem with it? Is there a reason why men more like eschew that particular method?
No, there's no problem with it at all. There's no problem with it at all. I mean, and it's quickly done, it's a local anesthesia, there's no problem with it at all. There are few connections, if you do it early, in the 20s, whereby they think that probably the incidence of prostate cancer may go a bit higher later on in life. But most studies have found out that even when it does happen, the men survive it because there are people who are calculated in life. So the odds are not against them in any way at all. All we will say is that vasectomy in the 30s, 20s is too early. Late 30s is good. 36, 37, 38. I mean, there's no risk to it at all.
Okay. All right. Look, like you can see on my platform, I have hundreds of messages. I wish we could, speak to all of these things, but if we try, we'll leave here tomorrow morning. So, guys, please pardon us. I've seen all your messages. It's just a shame we're unable to read all of them and respond to them. But the good thing is, our resource persons are grateful enough to share their contact with us and how you can reach them or how you can book an appointment to see them so that you can have your issues specifically dealt with professionally. And these are professionals that we can highly recommend so that we know that they're very trusted. Their years of experience are immense and they will definitely help you with whatever issue that you have. So let me start off with you, Dr. Sefogah. For those who want to reach out to you and come see you, where can they find you for starters?
Yeah, so I am at the Shape Healthcare Specialist Medical Center.
Okay.
Latipia Koshi.
All right. So for those who want to reach out to Dr. Prof. Sefogah, you can call the number 0302 631 880, 0302 631 880, or just go by the Shape Medical Center, the Specialist Medical Center, and they will certainly take care of you. Prof, for those who want to find you as well.
Right. So most of my work is in Kolebu. However, I mean, if you want a much more engagement, then probably the Trust Specialist Hospital or the Bank Hospital.
The Trust Specialist Hospital
Bank Hospital.
or the
But,
Bank
yes,
Hospital,
but high school.
and ask for Professor Kyei. Say you want to see Professor Kyei, book an appointment with him, and he would definitely avail himself and be of service to you. I mean, it's been really educative having you both here. I'm very grateful that you took time out of your busy schedule to educate Ghana and the world, because I know a lot of our friends are also listening from all over the world. Now, it's been very educative, and we're grateful that you made this edition of our health and wellness series a success. Thank you very, very much. Any final advice, maybe for you, Dr. Sefogah? That'll be for the woman, and then Prof will give it for the men.
Great. So,
Good. No, I'll say that for the men, please, we have solutions. And when we don't have solutions, we learn from the challenges and find solutions to them. So please, I'll say unveil, come around, talk to us, and there's solution. Don't wait. If it takes a bit too long, then the solution becomes more complicated, and then we try to avoid this altogether. Please just appear, and we will help you.
All right, there you go.
yeah, so to my dear woman, I say don't delay childbirth till it's too late. In the event you foresee that, let's freeze your eggs to safeguard your reproductive function. All these other symptoms I spoke about, don't sit on them till it gives you problems that become more difficult to solve. Women are so important to us. Your women's health is extremely important. So make sure you step forward. Let's detect the things early and deal with them. And since I'm supposed to talk to the woman, I can't leave without saying a big shout out to my wife,
There
Mrs.
you
Henrietta Sefogah,
There
our
you go.
MD at Shape Healthcare.
Good stuff.
It's a love man, so I love you.
Yeah, romantic doctor. the bald testosterone is working here.
That's right.
Well, I would end by saying that, ladies, Prof said that Prof said that for the thing to function, it has to be 2 inches is enough. Ladies, you heard it. 2 inches. Is it 2 centimeters?
It's 2 centimeters.
2 centimeters
Plus cash. Remember
Plus
that.
At some point, he even said the thing, if we get 6 minutes, it's okay. We stop killing the men with 1 hour. Stop killing the men with 1 hour. Anyway, thank you so much, and we're grateful.
Thank you.
God bless you. I'm Lexis Bill. Now, let me share with you, it's that time again, the biggest Roots Reggae Festival in Africa, the Kuchoko Roots Festival. It's on Saturday, 8th of March at Labadi Pleasure Beach, 12 noon. 50 Ghana cedis. You can get your tickets at kochoko.com and aquaba.app. From Kingston, Jamaica, for the very first time in Ghana, performing live culture featuring Kenyatta Hale, son of the legendary Joseph Hale, Dwayne Stevenson, Jordan Nooks, and of course from Ghana, the Kuchoko legend Black Rasta with the Herbalist Band, and a ton of others, including Nilante, the Bosco, Rasa Apia Levi, from Burkina Faso, Zimo, Ras Simple, and all. For more information, you can call 0244 499461, and that's the Kuchoko Roots Festival. Now, the third edition of the Women of Valor lands in the beautiful city of Lights, Paris, France. Now, get ready to experience the movement of audacious women sharing untold stories of courage and resilience. And this year's Powerhouse lineup include Chidima Adeshina, representing Nigeria, Miss Universe Nigeria, and first runner-up Miss Universe. Anna Sherbinina from France, a luxury real estate expert and CEO of AS Global Realty. Tucci Ivowi is the CEO of and founding member of the Ghana Commodity Exchange. Mame Jemfua Yeboah is the CEO and founder of Oh My Hair. Sika Goka is an etiquette coach and hospitality consultant. It's on the 7th of March. You can contact Travel Wings to find out more. 0556 749872. That's 0556 749872 for exclusive travel packages. Or you can visit www.womenofvalor.co for more details. So, Medicas Hospital is a modern healthcare facility built with your recovery in mind. It's got spacious wards built with your family in mind. A warm and caring pediatric unit built with your children in mind. We've assembled some of the brightest minds in medicine, led by Dr. Safo the Drive Doctor, and we offer general medical services as well as specialist services in plastic surgery, obstetrics and gynecology, child health, urology, psychiatry, and eye care. And additionally, we offer a comprehensive medical diagnosis service encompassing endoscopy, medical laboratory services, x-rays, and scans. We've got a 24-hour pharmacy that ensures you always receive efficacious, safe, and affordable medicines. And we bring you the most powerful medicine of all, simple human kindness. Come by Medical Hospital at number 10 Kincho Street near Ashalibuche School Junction. You can call us on 0501 477 340. Medical Hospital, a place of healing. I'm Lexis Bill. Thank you so much for spending time with us, and do have a wonderful evening. I'm back on your radio tomorrow at 3 o'clock. Make sure you're here. Enjoy the rest of your evening. Bye.